Good morning to everyone. Thank you for joining us. I know this is a very odd time of the day, 11 o'clock, and I know it's hard, but we're trying to get to as many cities as we can, and this time frame was helpful to us. And so thank you for being out here. This means a lot to me. I did want to introduce Dr. Jose Romero to my left, who will be helping me answer questions that might be more of a technical nature and medical nature. And I wanted to express appreciation to Mayor Simon. Where's Mayor? Thank you for always welcoming the city. I don't know whether it's better coming down here talking about flooding or coming down here talking about vaccinations, but you've always welcomed me, and I'm grateful for that. And we have some other mayors here. Would the mayors just stand and introduce themselves in the city? Go ahead. All right. Yes. Good to see you again. All right. And then Judge Tyndall is here. Thank you, Judge, for being here. And then, of course, we have Representative Mark McElroy, who's an important part of this conversation as well. And so we got how many are in education here? All right, we got some superintendents. I'll let you all, I know where you are now. You're right over in this area. So when we get to education, I can point at you, but we want to be able to hear from you. So let me start off by saying congratulations to Deshay County on making the goal of 50% of the entire population vaccinated by July 31. Give yourself a round of applause. Only 9 counties in the state at this point have met that goal. I expect that to increase. We got a few more days to work on. I think we're going to add to that number of counties. But Deshay County has really done well in terms of working hard from a community standpoint, encouraging vaccinations, and making sure that they're available. And we have Dr. Cheryl Stimson, is that right? Where are you? All right, so stand up, please, who has the Dumas Family Pharmacy, and she has a clinic out here, or vaccinations that's available, but most importantly, I wrote her a letter, and I actually signed it today, that your pharmacy has given out how many doses? 5,800 doses for one pharmacy. Yeah, and I know this is a community effort and other pharmacies, but thank you for having the clinic. Here, here. Yeah, here. All right, so with that bragging done, I'll come to the other point is we got work to do. And of course, even though it's 50% of the entire population, and you're higher than that, you're 53%, and then Chico County, by the way, is 46%. Work a little bit harder, and we'll get Chico County there, and Mayor. And then Ashley County's at 43%, so we got more work to do in some of our neighboring counties as well. But here's the challenge that we face, and that's the reason I'm having my community COVID conversations, is that we are really at a more risky place, not just in Arkansas, but the United States of America, because of the new Delta variant that has come along. And let me put it this way, on June 7th, now June 7th was not that long ago, right? June 7th was just 1 month previous, about what, 6 weeks previous. On June 7th, we had right at 1,600 active cases in Arkansas. Fast forward to today, we have 14,600 active cases in Arkansas, going from 1,600 to 14,600. If you just look at the daily new cases of COVID, in June we were in good position. It was only 62 cases on that day. but July 26th, it jumped to 621 new cases. And that was on a Sunday, I believe it was. And so we actually had a 2,000 new cases last week. We've had a couple 1,800 days. If you look at hospitalizations, which is always the most concerning statistic, on June 7th, we had 175 in the hospital as a result of COVID. On July 26th, we had 980, which means that we are close to getting over the 1,000 mark again. And the difference is that even though at one point we got up to 1,400 or 1,500 hospitalized because of COVID, we managed it because we really reduced some of the availability of the other surgeries and other health care needs. That's not a good thing for society to do. And so we're in a position now, if we want to make room for COVID patients in the hospital, that means you've got to delay other surgeries, other routine health care, and that's not, again, good for our hospitals. But we hope we don't have to get to that point, but we're very, very close to that point. In fact, I was up in Baxter County yesterday in which the hospital said they did have to delay a heart surgery because they had to utilize that ICU for a COVID patient. And so that's one of the reasons that because of the Delta variant that is more transmissible, that is more severe in its consequences and has twice the record of putting people in the hospital versus the earlier virus, it gives us a great concern. The second one is that even though you've met that goal here in DeShay County for vaccination rate, nationally, Arkansas is still below the national rate, and we've really got to pick up that vaccination rate because we have an urgent issue ahead for us, and that is school coming up in about 3 weeks. And with a Delta variant with more serious potential for some unknowns that are out there, we have to be ready for school, and the best way to get ready for school is to get everyone vaccinated. And so you've done well. We need your help to do more. But also part of this is a conversation, and I know we have a lot here that just might have questions. We've had some great questions that are constructive about what are the risk factors for getting the vaccine. There might be community discussion as to what more we can do here in DeShay County to get out in the rural areas, and there is a disparity. There's always higher vaccination rate in the city versus the rural area. How do we reach out to those parts of our community? But with school coming and the Delta rising, we've got to be able to act urgently in the coming 3 weeks. And so with that, I just urge everybody, when you make a question or a comment, and a comment's fine, but lead to a question, try to keep it short enough because within an hour we want to be able to get to everybody. And then secondly, just be respectful. And that's been the hallmark of all of our town meetings, maybe except for one. But everybody's been very respectful and respects other people's viewpoints. And so with that, I'm going to turn it open to this is your time as to how we can address increasing vaccines or answering questions and diminishing the hesitancy in our community. Yes, sir.
Joe Burgess, HamburgHeadlines.com. Hope this isn't an embarrassing question for me, but I was wondering if you had the Drew County and neighboring counties' vaccination totals.
I do have the Drew County vaccination totals, and so can somebody bring that to me? Jordan, she'll find that, and I'll come back to that, okay?
Thank you, sir.
All right. Yes.
I see Morel with Congress Commercial. First thing I want to ask you, where do you stand on giving schools, I understand the laws that are in place, but where are you as far as considering giving schools a choice whether they can mandate masks or not? You talk about the vaccinations, but what about the masks, especially for those 12 and under that can take the vaccine?
Great question, and And so the solution is get vaccinated if you're 12 and older. And so that has to be the first principal focus that we have, because that's what's going to give us a safe school year. I know we've got the superintendent here in Dumas who talked about having another vaccination clinic and expanding those opportunities. To your question, though, those that are 12 and under are not eligible to be vaccinated. That has not yet been approved by the FDA. And so our recommendation and our guidelines that we're releasing is we recommend that those children 12 and under to wear a mask. It's not mandated, but parents know how to encourage their children, help them to be prepared, wear a mask, and teachers obviously as well. Again, the law prohibits us from mandating that, but it is our guideline to encourage it, and that is solution. The other thing would be that, of course, in that age group, there's lower risk for the 12 and under, if the data shows that. And so we can protect them also by the family and everyone else around, older brothers and sisters, getting vaccinated. That gives them a safer environment to operate, less risk to them, and then if they wear the mask in the school, then they should be protected.
But just to piggyback off of that, will you call a special section to maybe consider lifting that rule to give the school districts more power to decide whether they want to mandate the masks? Because kind of the vibe that I'm getting from a lot of school officials is, man, if we had the power, maybe we could mandate the masks for all of these.
That is
children.
still being evaluated, undetermined. I'll be meeting with the legislative leadership a little bit later, and we'll have a discussion on whether there is support in the General Assembly for that. Obviously, there's a good argument that that's the essence of local control, let a local school district decide. But I hear they need to hear from the school superintendents on that. And so this comes back to, what do I got here? These are the counties. So there's Drew County, and you see Drew County is 39.9% fully vaccinated and 8% partially, so that's a total of 47% as compared to Arkansas County's 54% if you add them together. Phillips County 45% adding them together. Chico County 49, 50% adding them together. And so you can see where they are. Lincoln County really is the lowest with 30% vaccination rate, so a lot of work to do there. Dr. Romero, we had a very, very good question here about schools. Did you want to elaborate on that any, or did I?
Just to add to what the governor said, you know, masking in school is still a choice, and encouraging mask use by the students, by the teachers, is one thing we can do now, even if we don't have a mandate for the mask use in school. We can use it, we should use it. Children as small as 4 years of age, I've seen them in my clinic, can keep these masks on for long periods of time. So again, my personal recommendation is that if a child is going to school this year, they should wear a mask at all times.
Okay, let's hear from the audience here. Yes, ma'am.
Arkansas United. Dr. Romero, can you please repeat this message for the Hispanic community?
Con todo gusto. La pregunta fue si deben usar la mascarilla en escuela. No es un mandato por el gobernador de que todas las personas la usen, pero yo les quiero decir que es una forma muy efectiva de prevenir la transmisión del virus y la infección del virus. Todos los niños que van a la escuela este año, independientemente de la edad, deben de ponerse la mascarilla y mantenerla puesta durante las clases. ¿Okay? Es de suma importancia. Es la forma en la cual vamos a poder prevenir la infección en los niños menores de 12 años. Los mayores de 12 años, por favor, vacúnenlos. I'm sorry, Governor, a little bit longer.
Muy importante. Thank you. Yes, ma'am. I've heard good things about you already.
With the approval of my mayor, the mayor of McGee, and my county judge, I have formed a committee in McGee just this afternoon to give strategies on how we could better improve. Even though we are up there and over, we want to improve our rating for the vaccine. So we are planning on a door-to-door with volunteers that have had the shots to go around spreading in DeShay County, hoping that other cities and counties will follow us in doing this to make an improvement before the fall and the winter come in, which we know going to be very bad if we don't get more people vaccinated. So I want to know from you, do you think that that would be a great improvement if we could get people to follow that example, going door to door? Yesterday in Walmart, I got cursed out by one person, but I got 5 people to sign up for the vaccination. It was well worth it.
And the answer is that every community needs to figure out what works well in the community. And whenever you're looking at some people are homebound, they're not getting out, and they need to be vaccinated. And if they call the Department of Health, we will make sure they're aligned with a pharmacy that can go out and make sure they're taken care of. And so, you know, some areas resist knocking on doors, but it's not the government. It is a citizen. It's a neighbor concerned about other neighbors. And that is the distinction there. And so thank you, and I applaud you for caring and loving your neighbors, that you're willing to go out and remind them of the importance of this. Yes, ma'am, back in the back.
With or without this vaccination, whether you get vaccinated or not, I have a problem with Dumas School District. With the smaller kids, yes, y'all take more precautions and everything else because we know their bodies aren't strong enough to get this shot and they haven't fully grown enough to be guinea pigs to take the shot. So, furthermore, with that school taking more precautions, when you get to the junior high, they want to come up to make sure football goes as far as it goes. COVID took at the junior high school. I have teachers told, I have a child that's in the 14, that's going to be in the 9th grade. There is no 6 feet apart. There is none of that. These masks that you're talking about wearing, the only mask that's fully vaccinated to help keep us safe is the N95. But all of these masks that we got on in this room is helping nobody.
What's your solution?
For one, we got a lot of poor poverty people around here that don't have enough money to help stay clean or do what they need to do. And a lot of kids are going to school with these other kids. But the virtual part of it, you got a lot of kids that's flunking out, not doing what they're supposed to because you got a lot of parents that don't care about their kids. And a lot of people are putting their moral concerns in the wrong places instead of doing what they're supposed to be doing. And I'm a well-concerned parent around here.
Thank you. Thank you. I think what you outlined are the challenges that we face as educators, as parents, and you mentioned the under 12. You know, that is going to be a parental decision, even if they were approved for the vaccine. They're minors. They have to have parental consent to get the vaccine. We encourage that for 12 and above. We think it's important. Our experience, the data shows that it's very successful in protecting those young people. And we still don't know, and Dr. Jose Romero is a pediatric physician and has mentioned the special concern as to the young people this fall, because with the Delta variant, we still do not know some of how it's going to impact our young people. Dr. Romero, that's the extent of my medical knowledge, so I better yield to you on this.
Thank you, Governor. So the governor is correct. We haven't had a significant transmission of Delta variant in this country to be able to determine whether it's going to cause more severe disease in children. What we do know is this, that there is a certain proportion of children that will go on to develop complications after COVID infection. And that complication goes by the letters MIS-C. That's called multi-system inflammatory syndrome of children. We know that in this country, 80% of that population, of those children that get that, are either African American or Latino. And so we don't know why, but they are particularly high risk. And it's important for parents to understand that so that they can make the right decisions with regard to vaccination. And if I may just make a comment about the masks, if I please.
So, Dr. Romero, you mentioned the vulnerability or the concern. Does a vaccine address that concern? So we believe that by preventing by preventing infection, we will prevent these cases of MIS-C. I mean, we don't have the numbers at this point to show that definitively, but it makes sense. It's an extension of the vaccine protection. But I would like to address the question of the mask. So you are correct, ma'am, that the N95 mask is the best mask available for this type of protection. But we know from last year, from experience, that these cloth masks are effective in two things. One, limiting the spread of the virus outward, so whoever is infected will not spread large amounts of virus outward, and will also now protect the individual who is wearing the mask. So they do work, and we need to use them. It doesn't matter whether we have an N95 or not. These masks do protect children, protect adults. All right, let's do a very quick follow-up, and then we'll go to somebody else.
Okay, so if we do wear the mask and we do all we're supposed to do, why is it so many vaccinated people, even doctors that done had both shots and everything, still dying? Even kids are still getting it, and you're hearing the numbers are still high.
All right. So
but the problem is why? But where is any
very,
antibiotic?
very good. Let me jump in there. That's a good question. So the question is if the vaccine is so good, why do some people that have taken the vaccine still get COVID? And the answer is if a vaccine is 90% effective, that means 1 out of 10 could still get the virus. But what it shows is that of those that are hospitalized, 97% of those hospitalized because of COVID have not had the vaccine. And so it prevents hospitalizations. And if you look at more serious consequences, it's like 99.9%. And so it protects you, even if you might be in that small percent that contracted COVID, even after getting the vaccine, it's going to keep you out of the hospital, and it's going to keep you healthy. Dr. Romero?
Nothing to add, Governor.
Right.
That's exactly right.
All right, thank you. Let's go to yes, over here on the right.
Speaking of that, is anyone tracking that number statistic-wise for the people that's been infected from after they've been immunized?
Yes.
Is that number being tracked by the CDC or the state and local level so we could give those? I see a lot of people that are reluctant because of that very statement. They say, well, such and such had the vaccine and now they have the COVID. But I don't see those statistics anywhere, and I was wondering if that's being tracked, if there's somewhere we could look and see so we could give them that data to help inform them.
Very, very good point. And we do, CDC, and they've announced this, and the information is out there in terms of hospitalization. So that's where, when I say 97 or 98% of those that are hospitalized because of COVID, 97, 98% did not have the vaccine. They were unvaccinated. That is the strongest message that they're doing. In terms of the cases, like if we have 2,000 new cases that we announced yesterday or 1,500, how many of those had been vaccinated? Do we have that data or something we can compile, but I don't know if we have it on a timely basis?
So we don't have that data exactly, but we know that the vast majority, right, have not been vaccinated. So what the governor is saying about those individuals hospitalized, that's correct. 98, 97% have not been vaccinated, and most of the deaths, by and large, 98% of all the deaths we've recorded so far are in individuals that have not received the vaccine.
Yes, ma'am.
Taking my question. I'm going to try to be brief. When the lady mentioned about the schools, and my concern is, and I want to hear a little bit from the superintendents, what they are doing in the school to make sure that they are prepared to keep our kids safe, even though you wear a mask. And for the younger kids that do not wear a mask, what do they have a procedure in place that will help protect these children? Like she said about the spacing, and are they getting enough funding to do these things? Because this is a rural area, and sometimes we know how rural areas may not get things that the other areas are getting. So making sure that they get what they need to try to keep the buildings and what they are doing to keep them safe too, even though, we know that we need to recommend the mask, but there are some that's going to school that's not going to have the mask.
Yep. No, a fantastic question, and I'm going to ask Superintendent Kelvin Craig to address that, but let me answer it first, and where is he? Oh, he's coming in. But, all right, Kelvin, we got a question for you, but I'm going to answer it first in my way, and then you can talk about Dumas School. And the question relates to not everybody's going to wear a mask in the school. What's the school doing to protect the children? And let me first say that every school has federal money. It's called ESSA money, but every school has additional money to invest in improving ventilation in the schools, if they need space, if they need PPE to address COVID issues. There are resources in each school, and then we have state resources as well. So we don't want that to be an obstacle. And I know they've worked very hard on improving ventilation in the schools to help as we get ready for the school year. And Superintendent, I'll let you take it from there.
Yes, sir. Currently what we have done in terms of our ESSA money is we have, there were 3 different funds of ESSA. The ESSA 1 was primarily for PPE equipment. We have reinstalled waterless drinking fountains. Filling stations. We've purchased wipes. We probably spent $500,000 on upgrading and PPE supplies. In terms of our ESSA 2 money, what we're doing is for our ventilation system, we are replacing our HVAC unit at our high school. We are replacing our HVAC units at our lower elementary school, at Center Elementary. Many of you guys know that's been here, those units are probably 40 to 50 years old in terms of air quality. One of the things that we've done is we've kind of upgraded to on our buses in order to do better contact tracing to determine where those students are. We ended up recently providing some additional money for our teachers for additional duty, doing extra lunch duty, doing classroom cleaning, extra duty. Currently with our ESSA 3 money, we are looking at, we are required by policy to designate 20% of our, I say ESSA 3, but it's not ESSA 3, it's ARP.
All right, so go ahead and finish that thought, and then I want to call in some other but go ahead.
So the ARP, in terms of replacing our ventilation system at our other schools. So when you look at replacing those HVAC units, I know we were doing 2 of them, and that's probably right at $1.8, $1.9 million that we're spending just on those 2 projects alone.
Well, and I had a great conversation earlier in which you said you're committed to offering in-classroom instruction because you were convinced that virtual just didn't do the job that was needed for our students. So thank you for that commitment. And do we have some other schools that are represented if anybody wants to comment?
I'm not a superintendent, but I'm representing McGee School District today. I'm the school district nurse and the point of contact for our school district. Many of the things that he said McDumas was doing, we are also doing at our school district. Buying PPE, masks, hand sanitizers, touchless systems, water bottle filling stations, replacing AC units to have better ventilation are all things that we are also doing at our school district. And I also had a question. As the point of contact and the nurse of my school district, I've asked this question and I was told that it was still on the table waiting for a decision to be made. In March, when you lifted the mask mandate, they gave incentives to schools to continue their mask mandate, whereas if both individuals were masked, the person with COVID and the person in contact with them, then the person in contact did not have to quarantine. Will we be able to continue that quarantine rule as an incentive to try to get people to mask?
The answer is yes.
Thank you.
And so, was there more question? Because I want to elaborate on that a little bit.
No, thank you.
Thank you, and thanks for your work in the school, critical partnership that you have with our Department of Health. But Dr. Romero and I, we worked hard with our Department of Education colleagues in the schools on our Ready to Learn plan for this year that outlines our safety measures, and that will be released today. And what is key in there is that if there's incentive for vaccination, first of all, so that if you're vaccinated and you're in school and you're exposed to someone, you don't have to quarantine. And so if you're a high school volleyball player or have a band or some other extracurricular activities, that becomes really important to them. And I think that encourages vaccinations. The other thing is we do want to encourage the wearing of masks for those that have not been vaccinated. And so if you wear a mask and the person that exposes you wears a mask, then you do not have to quarantine because you're protected in that way. And the other thing would be the social distance. Of course, you're not exposed if you kept more than 6 feet away. Right, Dr. Romero? Do you want to elaborate on any of that?
No, everything.
Do you feel pretty comfortable with what I just outlined and getting ready for school this year and protecting our children?
I do, but I would feel a lot more comfortable if we were able to mandate mask wearing.
Do you think your school would do that if they had that option?
I do.
Hey.
We were a school district that continued the mask policy through the end of our school year after you lifted the mandate.
That's why we have these town hall meetings, so I get to hear from you. I think, all right, we'll go back there and then we'll come up here. You've got one, Shaylin, and then we'll come up to you, sir.
Good afternoon, good morning. I received information that the vaccines that we're getting, the life expectancy of protection is only 85 days. And then it requires a booster shot, which I'm told that those shots will be kind of hard to get because you have to pay for them. And then there are places you call and you want to be tested, but you can't be tested because if you're not showing any symptoms of the COVID, then they turn you down.
All right. So, great.
Now, what say you?
Yeah, thank you. Great questions, and I'm going to ask Dr. Romero to comment on that. Dr. Romero?
So with regard to protection from the vaccines, if you are fully vaccinated, we know that protection lasts, as of now, probably 9 months out. That's been shown now with the vaccines. They are effective and they do protect you. Now, you mentioned boosters. Boosters are being discussed. And they're being discussed for certain populations. So, for example, if your immune system is weakened because you have a certain condition, and there's a number of these, you may be in the future advised to get a vaccine. So all these issues of the vaccine boosters are being discussed at this time. As for the cost of the booster, I don't know of anything at this point that says that we have to pay for them. All of the vaccines that are currently administered have already been paid for. You don't have to pay for them. We give them for free. There may be an administration fee. I'm not sure about that, but I can find out. But the vaccines are for free. Actually, there is no administration fee. We also cover that. So I want to lay that to rest. The vaccines are effective, and we will have more information on who, if anyone, needs boosters in the next coming months. But the vaccine does protect you for a longer period than you mentioned.
All right, then we have a question right here.
Thank you, Governor. I'm Bob Ware from Vice Chancellor of the College of Technology in McGee. And that was a question on what we're doing to protect students. What we're doing at this moment, as we register students, as they come in and we register them, we strongly suggest that if they haven't been vaccinated, that they get the vaccine and be vaccinated. We can't require it. We also strongly suggest that they wear a mask. We have plexiglass in place for protection. We also have kind of social distancing in our labs and things like this to protect those students. So we strongly recommend, and a lot of them have taken our advice and got the vaccine. And we also offer masks for those that are willing to wear those. We provide those PPE for those particular applicants and also students.
Excellent. Bob, thank you. How's your enrollment doing this year? Good, good. Glad to hear it. Yes, ma'am.
I'm a clinical pharmacist. This is my hometown, but I work in rural areas all over the state. And I'm curious what the media strategy is to address vaccine hesitancy. I do have 2 rural facilities where I have 100% unvaccinated patients, and 100% of them are dead. So this is a preventable disease, and I'm just curious how we're addressing the hesitancy for vaccines.
All right.
Thank you.
Thank you. Great question. And do we have a good media campaign. We're spending millions of dollars on media marketing advertising. How many of you all have seen a Department of Health ad in reference to vaccines? All right. That's good. And do we have any of them? We're going to play one right here. Is this the doctor? All right. This is and Meg, is this one that's going to be out, or is this a? Okay. So this is part of our media campaign. I don't know if you need to.
My name is Adam Gray, and I'm a family practice physician in Melbourne, Arkansas. In the last 3 to 4 weeks in Izzard County, we've gone from 3 active cases to 92 active cases as of this morning. The Delta variant is spreading like wildfire. I have so far lost 32 patients to COVID-19, and I've consoled people who contracted the virus and gave it to a loved one who then died. And this is breaking my heart. A very large percentage of the people in Arkansas right now that are being hospitalized are under the age of 40 and almost exclusively unvaccinated. The side effects of the vaccine are negligible compared to these serious problems that people have. All 3 vaccines are widely available in the state of Arkansas. They're absolutely free for you. All 3 of these have been shown to be very safe and very effective against COVID-19. You need to get your vaccine because this can affect you even if you are not one of the people that we consider at very high risk.
Learn more at healthy.arkansas.gov.
Now, we have ads I hope that you've seen with influencers, which might be a sports figure, it might be a pastor or restaurant owner, small business. And so we've used a lot of different Arkansans in these ads. We're going to continue to do that. We're going to continue to get it fresh. Now, in terms of the hesitancy, that's a little bit more difficult because I don't know that if we want to start addressing mind control, which is one of the things they say, on our media campaign. But that's one of the reasons we have these town hall meetings, and I haven't had anybody express, well, they've maybe some hesitancy, but we try to address it in this fashion. But the key is everybody needs to talk to whoever they trust, and the best one is their medical doctor, somebody in the community that they trust that has the information. If they have questions in a particular area, to ask those questions. What are the hesitancy reasons that you're hearing? Hesitancy could just be, we want to put it off for a while, we want to see. What are you hearing?
Those hesitancies vary. I
Yeah.
mean, they range from political to community. Like people tend to stay around like-minded people. So if you have friends who aren't vaccinated and aren't getting the shot, then, and those are the people you associate with, then that tends to be the same mantra you follow. So it's across the board, but it's very distressing as a healthcare worker when you see people who their death was preventable because this option was available the whole time.
I agree totally, and we're going to continue to address that hesitancy and the urgency of action. What we see is that as the risk goes up, the vaccines go up dramatically. In fact, since we started these COVID conversations in our communities, these town hall meetings, our vaccination rates have gone up 40%. And so we've had a 40% increase in people getting the doses. Part of it is because we're doing this conversation. Part of it is because of your community response to it. And part of it is people just get scared. And they say, it's time. Thanks for raising that. Yes, Reverend.
Welcome again, Governor. 3 times in a short moment, made National Day of Prayer, the flood, now this. The hesitancy, and because you ran on a biblical values platform 7 years ago, the word says my people are destroyed because of the lack of knowledge. And that knowledge exchange varies in cultures. I don't know if we can put that chart back up with the Dumas Diche. If we can, you know, I represent today education, and we had a black doctor came who's an infectious disease expert who came, didn't know you were coming, but he came a few days ago. And the trust factor, if you look at that 45.1%, you know, low income, no income people, I would imagine if you shade it in, you'd see a lot of that. And in the ethnic type of analysis, you would probably see more. So what I want to ask is on the containment, and that's what the doctor told us, containment is a major priority. And we're going to be doing testing. People who have unprotected sex, before they go get shots, sometimes they get tested. That's kind of the routine. If I think I did something, let me go get tested before I go getting a lot of pharmaceuticals. So testing and containment, how important is that? I haven't heard us talk about that. But we will start testing Friday up to 200 or 300 persons on a weekly, bi-weekly basis here in Dumas. So I think hesitancy is because people don't know. Jump up and get a vaccine. If you're tested, does it help? And where's the advocacy and maybe resources for that?
You're talking about a COVID test.
Yes. The testing for the, and you talked, Dr. Marrero, about you don't know the Delta variant, the influence. It's not really registered yet.
So are you saying that they want to get tested so they know they're negative before they get the vaccines?
Hesitancy, yes. That's a correlation.
Yeah. Doctor, do you want to comment on that?
So you're speaking to exactly what the CDC is also talking about, that we need to roll out more aggressive testing in our communities, that persons that feel ill or are not even ill should undergo testing looking for this variant because it's highly transmissible. And understanding whether you're infected or not will allow you to place yourself in isolation. At the same time, not being infected is a great reason to go out and get that vaccine right away. Now, even if you've been infected, you're still eligible for the vaccine. We would recommend that you not have active disease at the time that you're being vaccinated so that you get over your infection and then you get vaccinated. But testing is part of the strategy for bringing this under control.
We had talked about we start Friday testing, and you can go online in the
Well, that's impressive, Reverend. You taught me something here, and testing dropped just whenever we saw the cases drop down, the testing drop down, now it's picking back up. And Doctor, I continue to hear that people think that testing costs money, and it doesn't. We want everybody to feel free to get tests. And does our pharmacy have any comment on this testing?
Cost, or the rapid test does have a cost, or if you go to our hospital, you do need to show signs or symptoms to get the rapid test. But as far as I know, the test that takes, a day or two is free.
Yeah.
You spit in the lab for 48 hours in the lab, and then you get the results back to the individual. And it is a cost, but it's not to the individual. It's through the CARES Act.
Right. Well, we've got to, well, first of all, the Department of Health has the rapid test as well.
So as the governor said, we have the rapid test and we have the PCR test, which is the one that's a more exact test. Testing is free at every local health unit.
Yeah.
So and we don't care whether you have symptoms or not. We want people to be tested. That's the asymptomatic testing that I was talking about, Reverend, that we want people who don't even have symptoms to get tested.
Do we have anybody from the local health unit here? Stand up and introduce yourself, please.
So we do rapid testing, but you do have to have symptoms. But if you don't have symptoms, then you can get a PCR anytime.
Well, I will make sure that we address this at this time. I think we need to give additional guidance.
No, we do the rapid, like if you've traveled or we're trying to get released from quarantine, we do have that. But we have been doing the rapid for anyone that calls that has any kind of symptoms, sore throat, cough.
The demand is not that great.
Yeah.
We need to give it.
Let me explain just for the people in the room. So if you have no symptoms, the best test is the PCR test. That's the one that's really going to give you the best answer. So that's why most places will not do the rapid test if you have no symptoms, right? That's why they're always going to tell you, no symptoms, get the PCR. Okay, if you have symptoms, we'll do the rapid test.
I just want everybody to meet you. Other comments? Yes, ma'am.
Yes, I'm Lisa Goodgame, Vice President of Operations for DePaul Community Health Centers, and we have a rural health clinic here in Dumas and in Gould that will provide the rapid testing and the test that we send to the LabCorp. So making sure everybody is aware, and you can come in with or without symptoms. No, we will not charge. There are some insurances that will pay for that, but we do not charge the patient.
So are you the hospital or?
No, we are a rural health clinic.
Great.
DePaul Community Health Centers.
Thank you. That's great news. That's why we need you here. Thank you. Where's our hospital? Is our hospital here? Yes. Can we hear from the hospital just as to what you're seeing?
Yes, sir. We're able to run the antigen test here also. We do offer the PCR as well. And what we're seeing is we're having quite a few positives right now, and we're having some of the same issues. I don't know why the supply seems to be an issue, but we're not able to get the kits that we're needing from certain manufacturers. We're on allocation again. Yep. And I mean, it's not that prevalent in the country, it's just in localized states or communities. And so I really don't know and we also have testing, and that's what I was going to ask. Have the guidelines changed? Used to it was like 3 to 5 days after you'd been exposed or you were showing signs and symptoms, that's when you would get tested. Is this new Delta variant, is it more, do we just need to do it as they come in if they've just been feeling bad or not exposed at all, or what's the guidelines now for the new Delta?
So the guidelines have not changed at this point. They may change in the future. We know that you can become symptomatic faster, but stay with the old guidelines until we have new modifications from the CDC.
Do you have any COVID patients?
Yes, sir, we have some. I think that's where some of the issues come in. I heard a lady saying that testing availability was not readily available, and that's what we've been going by as the guidelines. If it hadn't been 3 to 5 days, we want you to wait that extra, 2 or 3 days to make sure, that we can catch it in a timely manner instead of sending you home negative, and then you come back a week later and you're worse because we missed the window for the antigens to show up positive. So we're still sticking with that 3 to 5 days after you've been in contact with someone or after you've been, showing signs or symptoms.
We will take another look at it. Is that right, Dr. Romero? All right. Thank you. I see a hand. Yes, sir.
Thank you, Governor. I am Alan Miner. I am president of the Dumas School Board. And my question is very brief. You had recently lifted the mask mandate. Now, my question is this. As a result of the numbers of infections going up recently, are you giving any thought or any consideration to reinstating the mask mandate in the public schools?
Thank you. And the answer is I would like to see the local choice and option there, but the General Assembly passed a law that prohibits me or any state entity or school board from issuing a mask mandate. And so in order to change that, I'd have to actually call the General Assembly back in special session to address that and amend that law. And so there's a few hurdles to change where we are right now. And so in the near future, we've got to stick with the plan that we've outlined of asking those 12 and under, wear a mask, otherwise get vaccinated, because there's no mandate in the school.
Thank you.
All right, we got a few more minutes here, and so, all right, go ahead. Yep.
As I work in the community, what I run into is a lot of misinformation, and I think that's what makes some people hesitant about taking the shot, because there's misinformation on the social media, misinformation word of mouth in the communities, and it's really hard. Do you have anything that you could say about that?
Well, it is, and you just need to tell people, be careful where they get their information. I mean, there's an atrocious information out there that's not supported by the data. We should be following good medical advice and science, and so you encourage anybody who's getting false information to go to somebody who's trusted, whether it's their doctor, whether it's a nurse practitioner, whether it's a rural health clinic or a health department. Encourage them to go and get true answers to it. And then I saw another, let's see, Superintendent, I think you had a comment. Yes.
Just kind of follow up to Mr. Miner's statement a few minutes ago. I'll just talk loud. That in addition to, Act 1002 that was signed, I'm quite certain that you are, if the others are not, of the recent, I can't remember the attorney's name from Rogers, Arkansas, but he is in the process of writing a request for a judge to offer an injunction against Act 1002, which prohibits school districts from requiring the face mask. I know that you being originally from that part of the state, that you are familiar with that.
Yep.
In terms of a school district, I just think that it is absolutely ludicrous for the numbers to go up and the General Assembly pass a law that dictates or prohibits school districts from placing restrictions in place to govern the students of that particular school district. I know that it was passed, and I don't mean to be negative, but I just think that for us to not be able to dictate that our students,
I got you.
because we, in all honesty, the people in Little Rock don't know what's going on or what's best for our students
Yep.
in Dumas.
Hey, thanks for the. All right, so I got a business. Mike, did you have anything for your business? You good?
We're about, like Shea County, we're about 50%. There's been a lot of comments about the hesitancy. I've heard everything from, well, what are the side effects going to be down the road? Is it FDA approved? I mean, some folks are dug in about not wanting to take it. I think you could offer some of them a new car and they wouldn't do it. We're offering an incentive day, paid day, if you take the vaccine. We've had a few takers. So,
Good.
you know.
Doing all you can, just continue to educate. Thanks, Mike, for your leadership. And then we've got a couple, just if your hand's up right here, we got a lady, and then we got another one here, and then we'll conclude with that. I like to keep these to about an hour because y'all get hungry. Yes, ma'am.
I have this question for the doctor here. If you've already had the vaccine and just say you want to go work, you know, like at the school, I'm just going to use that for an example, and you wanted to just be retested, you know, you just want to have a test to be for sure that you don't have the variant that's going now. In some cases, I've been told that you don't have to have the test again. So now I would like to hear the doctor's opinion on that.
Yes, ma'am, that's a very good question. So if you have received the vaccine and you are exposed, then you need testing for part of your evaluation, as is indicated. So if you have the vaccine, it does not mean that you should not be tested in the future if you have an exposure. Did I answer your question, ma'am?
All
Thank
right,
you.
then we have the last one right here, sir.
Dumas School Board. And since we know that there is scientific evidence that wearing the mask reduces the number of infections, the question I have is, and since you're asking for input today, that's part of what you want. Well, my input is we feel that reinstating the mask mandate in view of the numbers that are going up with the infections right now, we feel that prohibiting a district from instituting a mask mandate hurts the numbers because of the fact that we're reducing the number of masks. We cannot require the mask be worn. So my input to you today is for someone to consider the fact that reinstatement of the mask mandate would have a direct reduction in the number of infections. That's basically my point.
Thank you for that, and that is why we're here, to listen to you. That's truly the essence of our democracy in a town hall meeting. I'll be meeting with legislative leadership, and I'll convey exactly what you said. All right, with that, let me just give yourself a round of applause. Y'all have been terrific for this. Really, I applaud this community, your leadership, the commitment of your neighbors that go out and knock on doors or encourage others to get vaccinated. So I hope that we can see the vaccination rate go up. I hope that we can have a very, very successful school year because it's important for our children. And we'll be working very hard across the state to do all of those things. So with that, thank you and God bless you.